Thank you, and I'm glad that you're still here. So, firstly, I would thank you for a very interesting day and a lot of things to take into consideration, some new things for us also. So in this last session, we're going to have focus on the views of the patient groups and community representatives. So we come from MEGD, which is the Faroese umbrella, with 24 member organizations. So we represent a wide range of people with different diagnoses, handicaps, and challenges. So MEGD's role in the society, we can say, is to be the voice to the political system to implement the Convention on the Rights of Persons with Disability into the Faroese society, which the Parliament signed in 2009. Today, we're going to present the perspectives which we will come back to later, but I think we'll just, before we start, we're going to explain how we see rural areas. How do we define what rural is? I have to shift this. Here. Yeah.
Yes, how do we understand, how are the Faroe Islands rural, you can ask. We are looking at that and we will compare the characteristics, Nelson's characteristics about rural. So the next slide, please. Yeah, in the Faroe Islands, we have 3 hospitals. We have the main hospital here in Tórshavn with 200 beds, and we have the hospital in Suðuroy with the 22 beds, and we have the hospital in Klaksvík North with 22 beds. We are rural, yes, but on the other hand, in our small country, there are short distances. The improved infrastructure connecting the Center Islands make the access to the main hospital easy. In South Island, as said, Suðuroy is not connected with a tunnel yet, but has its own hospital, as said, and in North as well. In all parts of the country, people have access to a general practitioner or family doctor in primary health care. Though for some people living on small islands, they have to travel by boat to visit the GP. For complicated illnesses, patients are being treated abroad, mostly in Denmark, and that number is increasing. In areas like neurology and oncology, there is made agreements with hospitals in Denmark, mostly with the Rigshospitalet, the main hospital in Copenhagen, and doctors travel regularly to the Faroes to have consultations. Yeah. So this is the characteristics for rural areas. But we will we have spotted out what is typical for the Faroe Islands. As you see, there is overlapping personal and professional relationships between healthcare providers and community members. There is limited availability of healthcare services, specialists and providers. There are small hospitals, many with fewer than 25 beds. Residents with close-knit and shared connections and experiences, shared values, interdependence and culture, limited rural ethic resources, lack of rural ethics literature, rural ethicists, rural ethics training, and rural ethics committees in the area. Though we had got the Ethical Council in 2018. And some research has been in ethics. For me, it's one known about one ethical research about how nurses use ethical guidelines. Yeah.
So when we spoke to Susanna, we got very curious, in fact, to ask our member organizations, what do you think? And the question was, what kind of ethical dilemmas can be in small-scale communities? So this, what we call today research, is in fact only, I don't know only, this is exciting, but it's in fact lifting the lid. We're seeing some interesting things, we think. So questions were sent out to chairwomen and chairmen in the member organizations, and then we got answers back from 7 organizations, and out of those questions we planned a focus interview, or a focus group interview with 4 representatives from 4 different member organizations. So that's how we got these, our data. So the recurrent themes that we saw, thinking was interesting in fact, was research, family used, too much and too little, equality in treatment, confidentiality, too much and too little, psychologist and healthcare authorities, doctor, family doctor, advantage and disadvantages, and then the doctor as an authority. So we go through very briefly these themes, recurrent themes today.
So according to anonymity, the participants said that there is a risk that you will be recognized, although it is anonymized. Perhaps you don't want to tell everything if someone will recognize. They talked about a case where it was done on investigation according job satisfaction, and they asked for age and department, and that was not informed. So although the leader wouldn't see who had answered, showed that they were afraid to answer all questions. So we can ask if was it because of fear of consequences. And they said also that it can be a risk that people can be more interested in who participated than in the investigation research itself. But on the other hand, if you exclude relatives or acquaintances, the investigation will lack important information. So, and then it's a risk of losing the point if you anonymize too much. Yeah. They talked about the bias, about the researcher. If you know the researcher too well, or the researcher know you, you can ask how independent is he or she. So there's a risk of prejudice for the researcher. But they also said that, okay, it depends on design. If it's a quantitative research, then it's not that big risk, but if it's a qualitative, it is yes. And you can ask if how free the participant feel, if he dare to be honest. They named the often. And that's the problem with interdependence. Will your honest answer influence the relation in a negative way between you and the professional or the service you get? And in the Faroe Islands, you must also commit that there's a risk of stigma, prejudice. You say they are these families, and then you don't look at the problem. Yeah. But we also saw that that there's a positive. They were very positive about participating, like Nomi Gregersen said. So they said that there are also many advantages to participate in research, because in the Faroe Islands there's been a very positive research history. Steuerwald, the pediatrician, has done a huge child research in the Faroe Islands, have found hereditary diseases who you can also cure or treat. And then you had, like Nomi said, the CDD, carnitine transporter deficiency. Some young Faroese people died from this disease, and it's very easy to cure. And we are many of with that the deficiency in the Faroe Islands, so which is very good that you have done research in that area. And then one of our participants told us that the child, a 9-year-old child, participated in a cohort research and was found random with mental disorder, which opened doors for help and support. The researcher, he was a Faroese, but he lived abroad, and you can ask, did he felt more free than the family doctor, the school teacher, and kindergarten educator, which she said they must have seen long before. Yeah. So how do you act in our small society? This doctor has, this psychiatrist has chosen this tragedy. Yeah. And then they told us that with the answers, told us that yeah, we had written answered and focus interviews. So this was from the written answers that with people with cognitive impairment, there are both advantages and disadvantages. The advantage is that the person with dementia, for example, is known in small societies. It's easy to see when people change, example, dementia. And if he or she goes astray, it's people will guide them and help them. But it is also a problem that people with cognitive impairment and brain injured are often excluded from research. They are often represented through others and their voice not directly heard. And you can say that that is not only the case in the Faroe Islands. Yeah. So, to show how positive they are, one participant statement was, quality research is beneficial. It's an ethical iniquity to hinder research because of risk of confidence. It is crucial to do research in order to get new knowledge, how a disease has developed and how it can be cured or relieved. And then we have the theme, family, too much and too little. The family plays a central role when it comes to help, support and care for a person with handicap. Historically, families in the Faroe Islands live close, though this has changed, the informant said. But it's expected as a matter of course that the family takes care of a person with handicap. Adult children with handicap live very long at home and there are lack of residences. And one interesting point was also that our informants point out a lack of support groups for families led by professionals. So, the written answers indicated that the family plays an important role caring for their relatives, and in the focus group it was interesting, they agreed very much about that, on that statement, and that the public sector expects and incorporates the help from the family too much and for too long. This was true for both parents to children with a handicap and the family where a family member suffers from dementia, in addition to people with mental diseases who often care for their relatives for several years. So, the family, they would like to be involved, but in a positive way. But it is crucial that they get support from the public sector. If not, they will burn out, get stressed, and end on sick leave. They said 1 krone given as support to the family will give 4 or 5 krones back to the society. In the focus group, it appeared that the family missed to attend support groups led by professionals because of the social system today does not offer this. Yeah, and they also said that historically we have lived close together, but that is changing. And the tendency is more today that adult children and parents and grandparents choose to live separately. So that means if the social system will not take this in account, there will be a bigger gap between the expectations from the family and the social care system. To investigate this would be interesting taking further in research. Then we have the theme equality of treatment. The written answers indicated that citizens are being treated differently. Some get better service than others. The focus group agreed and pointed out that if they have much resources, or you are well informed, know your rights and have a good backing from family, you get better help. Even some diagnoses give more support. If you have mental disease, you are not naturally offered help for eventual somatic problems because everything is put under the mental condition, and the result is early death. It also depends on whom you meet in the social and health system, if he or she is well informed or give you the right information. According to equality of treatment, it was interesting to read that to the election 14 days ago, one political party has put on a strategy that patients with cancer and heart diseases shall be offered treat guarantee within 2 weeks. I can quite understand this, but I can also ask, why not other diseases, also for example, lung diseases? Yeah. So yeah, people are being treated differently, as said. And it's a challenge at a certain diagnosis by law give people different rights and different possibilities. Yeah. So that could be a problem in a small-scale society.
When we talk about confidentiality, which we have talked about today already, we see that by law, we have good laws and they're easy to comply with. Here are some of the Faroese laws. In our research, we found the challenge can be in different teams working together. The interesting question can be, where is the right balance between personal information, what is pure personal, and professional information that is important for the sake of taking good care of the patient. Prejudice about the small-scale community and common thinking about confidentiality could be the cause of our question. This is one of the aspects we saw in the answers from the member organizations. But in our focus group interview, we saw that professionals work very professionally and respect both the people and the law. So we can say that professionals are being praised in our focus group interview. On the other hand, we could spot some other interesting results without asking directly for them. People think twice before they go to professionals. Here's one statement: you're in the same knitting club as the doctor's wife. Then you can hesitate to seek help when the help is personally too close. And another statement is here: you can be reluctant to seek help when the help is too close, for example, if you have a drinking problem or need psychological help. So interesting aspects can be seen in people being afraid of disappointing his or her acquaintances. For example, it can be difficult for someone to point out a problem. For example, if you think of your child, if your child has a diagnosis, it is a different case if you deal with a broken leg. Then I would just go over and say, I think your leg is broken because it looks that way. Here, you don't go for the personality. Another aspect we saw was this is a quite long statement. So the reluctance to include the family in the progress. So we see a different. There's a different mindset when the treatment is somatically hospitalization and when the mental, if it's a mental disorder or a disease. I'll just skip that, I think. Are we in, huh? Is this taking too long? So we can say that confidentiality has at least 3 aspects here. Professionals respect the rules and laws concerning confidentiality, but the challenge can be where we tend to think twice before we seek the help we need. And family is not sufficiently included in all courses and progress of the disease, especially the difference between somatically and mental treatment. Another thing was the psychologist. This was in the first question we sent out. It can be awkward to meet the one on the street, or your psychologist, that you have discussed very personal issues with. It can be awkward to meet your psychologist on the street. Even though we have not heard about the psychologist being unprofessional, it can give you a feeling of uncertainty when you meet someone on the street whom you have talked to about feelings and stuff. So from these thoughts, we can take into consideration that people, even if that a small-scale community make people in a way feel naked when they see professionals on the street, and this challenge is an expression that makes us ask: do the small-scale society or a community make it hard for people to seek professionals because of the fear of meeting them in other arrangements or on the street? This also sends, we think, a signal to the professionals, for example, to avoid to be the first one to take contact if they were to meet, again with where we started this morning. You mean there's no risk for you? Healthcare authorities. I think, in a way, this is kind of sad, I think. Patient can have reasons to hold back information, questions, or statements because they can influence the relationship between you and the family and the professionals and the management. This would be very interesting research, in fact. And doctors are serious authorities. People don't always dare to contradict a doctor. The doctor says this, and this is the way it's going to be. We can say that, we're not doctors. This is both an advantage and a disadvantage. Now and then, and this one says it laughing, now and then the doctor knows best, and other times he doesn't. So we can take that into consideration. Is the time gone, Susanna? Yes. Yes, I think we'll stop there. I would just like to show you Lukka. This is a Faroese book about the Convention on the Rights of Persons with Disabilities. So please take one with you, and if you have it already, give someone else this book. And this is Lukka, it's called. How do you say Lukka in English? Happiness, it could be, yes. So it's an impression when we see children come in, we say, look, you're here. So this is a teddy bear that Edvard Fugl has drawn. So please take a copy with you. Yes, just this, Susanna. I'll be finished now. So we would like to see some more research on the disability area. So this could be some ideas for further research to study Faroese law with a Convention on the Rights of Persons with Disabilities as a ground, social studies, equality in treatment, the rapid change of society and the lack of change in social service. The importance of the family doctor compared to the substitute doctors, and whose voice is heard in the society, especially when you talk about people with handicap and family, too much or too little. Thank you.